Good morning, Carlos Bastardo with American Insurance Brokers and Hudson. Today, I want to cover briefly on how to navigate the marketplace, right? Last night, I saw a commercial on TV. It talked about health insurance, and it was this flowing, glamorous little commercial that talked about going to Healthcare.gov to enroll in insurance. Well, the reality is it can be very difficult to navigate, and if you don't correctly go through the right steps and procedures and put in the correct amounts that they're asking for, you could be denying yourself quite a bit of money in tax credits or premium dollars. So before I get into this video real quick, I just want you to know that if you don't want to have to worry about navigating the marketplace or doing it yourself, all you have to simply do is give me a call at 574-529-3099 or simply shoot me an email at carlos@aibins.net. Of course, you can visit our website at www.aibins.net. And we can simply, I have a special software to quickly go through this whole process. I'll do it for you on your behalf. It doesn't cost you a dime extra than if you did it yourself. And you have me as an agent to help you along the way if you ever have any problems or you need to make changes. Trust me when I say my clients, once I help them with their health insurance, they just let me do everything for them because it's an easy process for me. But if you are adamant on doing it yourself, then I'm going to go ahead and show you the process. Now, if your particular state where the state runs your marketplace, like New Mexico, unfortunately, this won't work for you. You'll have to go through your state's specific website, but almost the rest of the normal United States uses Healthcare.gov. So I'm going to go ahead and share my screen, and we're going to jump right into this. All right, so step one is you're going to go to www.healthcare.gov. Right here, I've got a shortcut, so I'm just going to click on it and go there. You may have to click around a little bit until you see this. It says see plans and prices. Get estimated prices, yada, yada, yada. So in here, you're going to type in your zip code. I'm going to use mine. And you want to make sure you select the proper county. So I am in Marshall County. Click on continue. And then you're going to click on start. And then you're going to list your household. So if you are getting insurance only for yourself, you're going to click on just you. If you have other people to insure, or that's part of your household, even if they're not being covered, you need to select on you and other people. So this is the part where people screw up the most, right? They may have a spouse and 3 kids, but they're the only ones that need insurance, so they click on just you. It's not going to give you accurate numbers. So let's say you do have a family. You're going to click on you and other people, continue. And it's going to say, are you married? Right? If you are, again, whether or not they're getting insurance, you're going to select yes, continue. And then how many dependents will you claim and file on your federal tax return? So if you have a 23-year-old child living at home that is self-sufficient other than living in your home, but you're not going to claim them on your tax return, then you do not include them. All right. So let's say we have 3 kids, right? Going to click on continue. Now we're going to go over the ages. So it's always going to be yours first. So let's say I'm a 35-year-old male and I need insurance through the marketplace. So I'm going to skip all these, right? The other options are eligible for health coverage through a job, Medicare, Medicaid. So you'll select this if this is the scenario with one of your family members who does not need marketplace because they have it somewhere else. Legal parent, guardian of a child under 19, pregnant, all right, do not include a baby as a dependent until it's born, okay? So you cannot include one in the oven. And then, of course, tobacco user. If you're a tobacco user, click on that. Click continue. Right, next it's going to go for the spouse's age. So we'll say the spouse is 34, female. And let's say she's covered through her employer. So we're going to click on that, click on continue. But you need to cover the 3 dependents. So now we're going to put their ages in here. So we'll say we have an 8-year-old male. None of these, they need coverage. So none of those exceptions apply. And then we have a 7-year-old female. Again, needs coverage, so none of those apply. And the last one, we'll say a 5-year-old male. Again, who needs coverage. And we click on continue. All right. So now we have this here. It shows you need coverage. Spouse has an exception because they already have it through the employer. And then all the dependents here need coverage, so you won't see any exceptions listed there. Click on confirm. And then expected 2023 income. This is the second area where people screw up the most. Okay. This is based on your gross income, not your net. So you're not going to exclude taxes. You're not going to exclude any IRAs, that you have taken out of your income, blah, blah, blah. So simply, if you know what your annual income is, let's say normally you're at 48,000 before taxes or any expenses, that's the number you're going to go with. If you don't know your number, but you get paid hourly, right, then all we simply do is we go to the calculator, say you make $22.50 an hour and you work a normal 40 hours a week. All right, that number is 900, and then we take that times 52 weeks. That gives you 46,800. That's the number you go with. Okay, they want annual income. So let's say you make 46,800 and your spouse makes, say they work part-time and they make 20,000, right? So 20 plus 46 is 66,800. Now, if you have older children and they also earn an income and they're getting covered under this plan, then you need to also list their income. This is total household income. Okay. So 66,800, click on continue. And then we're going to get this number here. Okay. And let me explain how to read this. So based on the information so far, Healthcare.gov is stating that supposedly dependent 1, 2, and 3, so the kids are supposedly eligible for Medicaid, or what is known as CHIP, Children's Health Insurance Plan. Here in Indiana, that's what it's called. In different states, it might be called something differently. Okay. So it doesn't say that they're going to go on Medicare or Medicaid, sorry, but the application is going to get, once you process it, is automatically going to get sent to the state to see if they qualify. All right. If they don't, then you will be able to add them back on this application at a later date once you get a denial letter. But with that being said, your responsibility is to go ahead and fill out the information as soon as you receive it from the Human Health, HHMS, I think it is called, Services, HHS, sorry. You'll get that letter from the state. You need to follow through and fill out the information for qualification. If you don't, it's going to mess everything up with the application. You may not be able to get the kids covered. So make sure you follow through with that process. So for now, it's only showing you as the individual eligible at this point to enroll in the marketplace. And this is going to be the average estimate of cost per month, I believe, based on a silver plan. We'll get to that here in a second. Now, group 3, right, it separates your spouse because basically it's just stating here This group won't be covered by plans you preview here because they have coverage through work. That's why we selected that exception. Okay. So really at this moment, we're only looking at coverage for you until there's a determination on the children. So now we're going to click on View Plans. Click Next. See All Plans. Now, this is where it can start to get a little confusing, a lot confusing, sorry, is trying to look through these plans and understand how they work. I'm just going to go ahead and say right out of the bat, I always filter to a silver plan because that's where you're going to get the best cost savings for tax credits that you're able to earn due to your income. And if you look here, your estimated tax credit is $273. What does that mean? That's going to come off of the top of the premium for that plan, and then you pay the difference, right? So that's why tax credits are important. So if we look at this bronze plan, normally the cost would be $312.61. After your tax credit is added in here, then the difference you pay is only $39.61. However, going back to this being a bronze plans are high deductible plans. What does that mean? In this case, you're going to have to meet the $65.50 out of your pocket first before anything is paid, the exception only being preventative care. So your preventative care, such as your, mammograms, pap smears, annual checkups, those types of things, those are covered at no cost out of your pocket. Everything else you are going to have to pay towards your deductible first. So unless I just need the cheapest insurance possible, I'm willing to roll the dice, I just want catastrophic coverage in place, that's when you would choose a bronze plan. The other exception to a bronze plan in a lot of cases are people who are self-employed. Okay, and you can go here to the filter section, you can click on bronze only, and then you can also select right here, eligible for an HSA. Okay, apply filters. Now this option will show you which plans are HSA available, okay, or eligible. What does that mean? Right, this allows you to open up a separate account. It's called an HSA account, and you can put up to your deductible, well, up to the maximum amount per individual or family per year in that account. You would fund that account aside your premium. So you're still going to pay $122.73 a month for this plan. It still has a $6,000 deductible before anything's covered except for preventative. And then you're going to fund that account separately. The advantage to that is any of the money you put into your HSA account is tax deferred or pre-tax, they call it. So if you make $48,000 a year and you put $6,000 of that into an HSA, then technically you're only earning $42,000 instead of $48,000 because it is a pre-taxed benefit. Okay. Now that money that's in that account, you'll get a debit card for it. You can only use that money towards qualified purchases. They have the systems in place now where it's not going to let you buy something that doesn't qualify. But if you do happen to get away with buying something that doesn't qualify, that becomes taxed and you do pay penalties on monies in an HSA account under the age of 62. So do not use this money nilly-willy other than for medical purposes. The other nice thing about an HSA plan is that you can continue to bucket this money each year, even if you don't use it. So let's say, and let's look at the limits. They change all the time, right? HSA max contribution for 2023. If you look at this chart here, it's going to show you individuals versus family and what the amounts are. So in 2023, as of this year, if you're an individual, which in this particular case, in this quote, it's an individual. Well, I'm sorry, I take that back. It is a family provided we get the kids back on the plan. That's why these things get confusing. As of right now, it is individual, right? So until we get the kids back on, it's individual. So the most you could fund an HSA as an individual is $3,850 for the year. If it's for your family, right, more than one person, then you can fund it up to $7,750. One more exception: at age 55 or older, you can contribute an additional $1,000 per year to help do what's called catch up if you want to. Okay. So that would go to $4,850 or $87,750. Okay. So that's the max contribution, going back to the HSA. So that would cover a little bit over half of a deductible. But let's say you don't use it, you're perfectly healthy, and you never use your HSA account. The next calendar year, you can fund it again for another $3,850. So you can continue to fund, and it builds up a nice little slush fund for you in the future to use towards medical or premiums or to convert after the age of 62. Okay. So those are the primary reasons for picking a bronze. Number one, you don't care about a high deductible, you just want something cheap. Or number two, you want to take advantage of the HSA for tax favorability. Self-employed people definitely love this. And if you choose this route, but you're still concerned about some of the gaps, I have gap coverage that you can purchase to help cover some of these additional costs. Okay. All right. So now let's go back to filter. Going to get rid of that, go back to filters. Now we're going to look at the silver plans. Silver plans are the most common plans that most of the clients want, especially if you qualify for tax credits, because this is where you're going to get your best savings. It's where you're going to get lower deductibles potentially, right? And copays. So most people want something to have copays. Right. But there's one more problem: picking the right carrier. How do I do that? Well, there's a little tool right here that says add doctors and facilities. So let's say, for example, I want to look at a local doctor. Sorry for promoting you. All right, but Dr. Stilson here was our family practice doctor for many, many, many years. I want to make sure he's in my network. Okay, click on continue. And as I start looking at these plans, right, the first plan I see is Anthem. It's the cheapest plan because they list the lowest cost first. But Dr. Stilson is not in the network. That's a problem, right? So we're going to go ahead and scroll down and look at the next company, which should be Ambetter. Ambetter. And again, Dr. Stilson is not in the network. That's a problem, right? And by the way, just to save time, you can add specialists, you can add hospitals and other facilities that are important to you. All right, so I know for sure that Dr. Stilson does take CareSource as of the recording of this video, and there he is, right? So I know that CareSource, out of the three options that are available right now, is the only company that's going to offer coverage with Dr. Stilson. So what I need to do is go back to add more filters, and to keep things simplified, I'm going to select insurance companies, CareSource only, right, to eliminate all the other plans. Click on apply filters, and there we go. So now I see the plans that are available to me. CareSource Marketplace Low Premium Silver 1 with the $6,000 deductible. If you click here, it'll give you the breakdown of copays. So primary care visits are $25, specialists are $60, urgent care $50, so on and so forth. Prescription drugs are covered, right? So $6,000. All right, I know what I get here for $148.89. Okay. Now, if I want to step it up a little bit, for only $10 more, I can add dental, vision, and fitness, right? What is fitness? That means that CareSource will pay for your gym membership. Okay, so dental, vision, and gym membership, you get all that for only $10 a month, right? For 10 bucks, right? You can't go wrong. So most clients, I'm going to urge them to go ahead and take this, and then they know the coverage they have for $158.09. Okay, so you could look through the other plans and kind of go through them and do the same thing we did here and compare co-pays and so on and so forth. Find the plan that's best for you based on your needs and your budget. But let's assume you like the 1 year we talked about. You're going to go ahead and just click on you can do a comparison. Click on this and other ones if you like. Let's assume you like this one. You click on the plan name, right? You can pull up the documents. So click on plan documents, summary benefits. If you print that, it'll give you all the co-pays and so on and so forth, right? And then you can click like this plan, take the next step. And then at that point, you'll click on see if you qualify for enrollment. It'll make sure that you have an exception if it's not open enrollment to be able to get coverage. You'll create an account at Healthcare.gov, and then you'll have to go ahead and verify who you are, and then you can go through the whole process at that point. All right. So again, an easier option, just give me a call, shoot me an email or a private message, and I can make this a lot simpler for you. I can go through it very quick with the application process that I use. But if you still want to do it on your own, then I hope this at least gives you some perspective on what to expect and how to kind of weed through the insurance. I've done this for 30 years, so it's a little bit easier for me. But I hope this helps. If you have any questions in general, then feel free to get in contact with me. Remember, open enrollment is coming up around the corner, begins November the 1st. So if you need some help, give me a call, IM me, and we'll make sure you get taken care of. I'm Carlos again with American Insurance Brokers, protecting your way of life. God bless.